Exploring the brain. Hi everyone, today we will be discussing about neuroimaging and neurotransmitters. In this video, we'll explore two fascinating topics related to the brain: the role of dopamine in Parkinson's disease and serotonin in depression. We'll break down complex concepts into simple explanations and use visuals to make it easy to understand. Let's dive in. In summary, neuroimaging techniques have played a pivotal role in enhancing our understanding of the brain's functions and structures. These non-invasive methods, including CAT scans, PET scans, MRE, fMRE, and EEG, allow researchers to visualize and study the brain's inner workings. They have not only advanced clinical diagnosis, but also expanded our knowledge of cognitive processes, emotions, and behavior. Neuroimaging has been instrumental in unraveling the complexities of neurotransmitters like dopamine and serotonin, as we'll explore further in this discussion. The role of dopamine in Parkinson's disease. Here we can see some symptoms of Parkinson's disease so we can understand what we're gonna start talking about. So I'm gonna try to explain to you guys what are the symptoms of this disease. Parkinson's disease is a progressive disorder of the nervous system. It mainly affects movement and is characterized by symptoms such as tremors, rigidity, bradykinesia, that is slowness of movement, and postural instability. Other symptoms may include difficulty with balance, speech and swallowing problems, and changes in mood or cognition. It causes by a loss of dopamine-producing cells in the brain. Treatment options include medication, therapy, and lifestyle changes. It's important to consult with a healthcare professional for a comprehensive understanding and personalized management plan. I'm going to start explaining the study by Fred et al. Now, in this study, they had 40 patients with severe Parkinson's disease. These patients were split into two groups. One group received a special treatment where they got nerve cells from embryos implanted into their brains. The other group had a fake surgery where holes were drilled in their head, but nothing was actually put in. Both groups were closely watched and tested for a year after the procedures. They used brain scans to see what was happening inside their brains. Here's what they found. First, in both groups, they saw more dopamine-producing cells in a part of the brain called the putamen. The patients who were younger, 60 or under, in the group that got the special treatment, had their symptoms improved by 28%, but the older patients, over 60, didn't get better. So, what's the big takeaway? Well, they found that putting dopamine-producing cells in the brains of younger Parkinson's patients seemed to help them, but it didn't work as well for older patients. It's an important step in understanding how to treat this challenging disease. Dopamine is like a messenger in your brain. It's a chemical that helps brain cells communicate with each other. Think of it this way. Imagine you have two friends and they need to talk to each other. Dopamine is like the text message they send to each other to share information. It helps control lots of important things, like your mood, your ability to move, and even how you feel pleasure. When you do something you enjoy, like eating a delicious meal or getting a hug, your brain releases dopamine. That's why you feel happy or satisfied. Now, in some diseases like Parkinson's, the brain doesn't make enough dopamine. This can lead to problems with movement and other issues. Scientists study dopamine to understand how it works and how to help people with conditions like Parkinson's. In simple terms, dopamine is like a helpful messenger in your brain that makes sure everything runs smoothly. Now, let's shift our focus to serotonin and its connection to depression. Serotonin is another important chemical in your brain, and it plays a role in your mood and emotions. Imagine serotonin as a mood regulator. It helps keep your feelings balanced. When serotonin levels are just right, you tend to feel good and content. But when there's not enough serotonin, it can lead to problems like depression. Scientists have been studying the link between low serotonin levels and depression. They do this by looking at how certain drugs can affect serotonin in the brain. If a drug that boosts serotonin makes people with depression feel better, it suggests that low serotonin might be part of the problem. However, it's not a straightforward story. Serotonin and depression are connected, but it's a bit more complex than just having low serotonin levels. Some people with depression don't respond well to drugs that affect serotonin, which tell us that there's more to that puzzle. So, scientists keep exploring this connection to better understand depression and how to treat it effectively. Imagine you have a car, and the gas in your car represents serotonin. When your car has enough gas, it runs smoothly, just like when your brain has enough serotonin. You feel good and balanced. Now, let's say your car runs out of gas. It starts sputtering, slowing down, and eventually stops. Similarly, when your brain doesn't have enough serotonin, it can lead to depression, where you might feel sad, anxious, or low. So, the serotonin hypothesis suggests that low serotonin levels in the brain can cause depression, just like running out of gas can stop your car. To test this, scientists give some people medications that boost serotonin, kind of like adding more gas to the car, and see if their depression improves. But here's where it gets tricky. Sometimes, when you put more gas in your car, it doesn't instantly start running perfectly again. Like, it takes time for the engine to respond. This is similar when people with depression take drugs that increase serotonin. It can take even weeks for them to feel better. This delay suggests that serotonin might be just one part of a more complex system. Also, not everyone with depression gets better with these medications. It's like some cars run better in certain type of gas, but others just don't. So this just shows that the serotonin link to depression isn't universal. It doesn't apply to everyone in the same way. Serotonin's role is more like a piece of the puzzle, and there are still many other factors we need to explore to fully grasp depression. Stress. Think of stress like heavy rain on your car's windshield. Just as rain can make it challenging to see the road clearly, excessive stress in life can cloud your mental well being and potentially lead to depression. Stressful events like work, pressures, or personal problems can increase the risk of developing depression. Now, genetics. Consider genetics as the unique blueprint of your car's engine. Your genes, inherited from your family, can influence your vulnerability to depression. Researchers have identified specific genes, like the serotonin transporter gene 5-HTT, that may make some people more prone to depression when they face stressful life events. In a sense, it's like some cars are more prone to engine trouble when driving in heavy rain, while others handle it better. Similarly, genetics can make some individuals more susceptible to depression when dealing with life storms like stress. However, it's important to note that genetics is just one piece of the puzzle, like I already said, and the interplay of various factors contributes to depression's complexity. So, everything we already talked about, the concepts are essential in the field of psychology and neuroscience. They help researchers better understand brain functions, neurotransmitters, and mental health disorders.